Hello everyone. Today, we're exploring the medication Mayzent, also known by its generic name, Siponimod. This discussion is intended for educational purposes. If you have health-related questions or concerns, consulting with a medical professional is always recommended. Description: Mayzent, Siponimod, is an oral medication that belongs to a class of drugs known as sphingosine 1-phosphate receptor modulators. It is specifically designed to modulate immune system function to reduce flare-ups in certain conditions. Approved by the FDA in 2019, Mayzent is primarily prescribed for treating relapsing forms of multiple sclerosis, MS, including clinically isolated syndrome, relapsing remitting disease, and active secondary progressive disease. By binding to specific receptors on lymphocytes, it prevents these white blood cells from exiting lymph nodes, reducing their ability to cause damage in the central nervous system. This action helps in reducing the frequency of relapse episodes and can slow the progression of physical disability in individuals with MS. Warnings: Mayzent should be approached with caution. It is not suitable for everyone, including those with certain cardiac conditions due to its potential to cause heart rate reduction at the start of treatment. Patients with a history of stroke or transient ischemic attack, TIA, within the last 6 months, as well as those with certain types of heart block without a pacemaker, should avoid this medication. There's also a risk of infections, so patients with a current or recent infection should inform their doctor before starting treatment. Liver tests and a complete blood count are recommended before the initiation of Mayzent to assess the suitability of the patient for this medication. Before taking this medicine. Before starting Mayzent, inform your healthcare provider if you have a history of heart problems, including a slow heart rate, or if you're taking medications that affect your heart rate. It's important to discuss any liver issues or if you're prone to infections. Those who are pregnant, planning a pregnancy, or breastfeeding should consult with their healthcare provider due to the potential risk to the fetus or infant. Vaccinations should be up to date before commencing treatment with Mayzent, as live vaccines are not recommended during treatment and for a certain period after stopping the medication. You should not take Mayzent if you have certain severe cardiac conditions, untreated sleep apnea, or if you are currently suffering from an active infection. Patients with severe liver impairment should also avoid this medication. Before starting the medication, inform your doctor if you have had a recent vaccination or if you are scheduled to receive any vaccine. Additionally, patients with a history of uveitis or macular edema should discuss these conditions with their healthcare provider due to potential drug effects on the eye. Side effects: Mayzent, like all medications, can have side effects. Common ones include headache, high blood pressure, and liver function abnormalities. There's also a risk of macular edema, a condition that can affect vision, and patients should be aware of the symptoms including changes in vision or eye pain. It's crucial to monitor for signs of infection, as Mayzent can decrease the body's ability to fight infections. Serious side effects may include breathing problems, liver damage, increased blood pressure, and severe skin reactions. If you experience symptoms such as trouble breathing, yellowing of the skin or eyes, severe tiredness, or a rash, seek medical attention immediately. Interactions: Inform your doctor about all medications, supplements, and herbal products you are taking, as Mayzent can interact with other drugs. Special caution should be used when taking medications that affect the immune system or vaccines. Dosage: The starting dose of Mayzent is generally a titration pack that gradually increases over a week to reach the full dose, reducing the risk of heart-related side effects. The usual maintenance dose of Mayzent is 2 mg once daily. It is important to follow your doctor's instructions precisely and not to alter the dose without consulting them. Avoid: While taking Mayzent, avoid receiving live vaccines due to the increased risk of infection. Patients should also be cautious about activities that could expose them to infection, given the medication's impact on the immune system. FAQ: A common question is about the age limit for Mayzent. Currently, Mayzent is approved for adult patients and its safety and efficacy in individuals younger than 18 have not been established. Closing. This concludes our overview of Mayzent, Siponimod. Remember, this information is for educational purposes and is not a substitute for professional medical advice. Always consult a healthcare provider for any questions or concerns about your treatment. Thank you for joining in today.